Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and today I wanted to talk to you about neck pain. You see, there's so many different types of neck pain, but there's two very common types that we tend to treat in chiropractic practice. And the first one is what I'd call is mechanical neck pain. It's a change in the normal mechanics of how the neck works. And often that's caused from an injury, whether it's an injury to the muscles, to the ligaments, to the tendons, or even to the little tiny joints that are situated at the back of the spine called facet joints. Now, all this tissue has nerve fibers mixed in with it. And if we injure the tissue, those nerves will be irritated and they will cause pain. Now, often the pain is localized. It's very localized to where you may have done the injury, but sometimes the pain can spread, and we call that referred pain. It's because certain parts of the body are supplied by similar nerves, and so when you injure one part, sometimes your body perceives that the pain is coming from another part that is connected. So sometimes patients will have an injury to their neck and they may feel it into their shoulder, or they may feel it down to their shoulder blades, or even into their head and complain of headaches. So chiropractic is fantastic at treating that because it's, of course, mechanical neck pain, and chiropractors are great at treating mechanical problems of the neck because, of course, we adjust the spine. The other cause of neck pain is a disc problem. So everyone's heard of these intervertebral discs, and you may have seen my videos where I talk about how to care for your discs. But these discs have a little ball of jelly in the middle, and sometimes those hard fibers on the outside of the disc can get tears in them, and the little bit of gel in the middle can squirt into one of those tears and cause a bulge. A bit like we're seeing down here in the lumbar spine, down here. And that bulge can cause compression on the delicate nerves, what we call nerve roots, that exit from the spine. Now, the pain associated with the nerve root being compressed, it can be quite severe, quite deep and quite intense, and it will often cause what we call radicular pain. And that's pain that not only just maybe you feel in the neck, but it's pain that you'll feel deep in the arm and potentially all the way down into the hand. So radicular pain is quite severe, and it's caused by a nerve being compressed by the disc itself as the disc bulges out. Now, we need to make sure that we examine our patients properly, because sometimes that disc bulge is beyond the scope of chiropractic and could require immediate surgical intervention. So always, please, when you see a chiropractor, make sure that a proper examination is done at the very first consultation to ensure that we know, first of all, what is the cause of the what is the cause of the neck problem, and if it is a disc, to ensure that it is appropriate for chiropractic care. So two causes: mechanical, joints not moving, muscles, ligaments, tendons, causing what we call referred pain, or a disc injury causing radicular pain. Either way, make sure that you get your spine checked professionally whenever you're suffering from neck pain. Until maybe we catch up, remember, look after your spine.